صباح الخير طلاب المرحلة الثالثة كلية طب جامعة نيسان. Today lectures about infectious diseases. We start with the first lecture, hydatid disease. As you know, it is one of the commonest disease in Iraq and Middle East area. These are picture for the cyst, mother cyst and daughter cyst. Echinococcus granulosus. Adult, note that the tapeworm body, strobile consists only of 3 proglottides and measures only about 5 millimeters. These are 3 pieces of the adult worm. This diagram shows the hydatid cyst. These are the daughter cyst. This is a big cyst, and this is the connective tissue of the organ inside it. This is the pedicle of the cyst. Microscopical picture for hydatid cyst. Hydatid cyst showing a row of broad capsules, attached to germinal layer. Broad capsule attached to germinal. All these are called daughter cyst. Life cycle of hydatid cyst start with adult in small intestine, then the eggs ingested by human, and these eggs can be penetrate the intestinal wall. They consider as infective stage. These are the eggs. And D, diagnostic stage. This is hydatid cyst in the liver and lung. And then from this side, protoscolysis from the cyst, and then scolysis attached to the intestine. This is the intermediate host, the sheep, and this is the definitive host, dogs and other canids. So the most important organ for the hydatid cyst, as you see in this diagram, this is small intestine, large intestine, stomach, and even brain. Actually, hydatid cyst can affect any part of the body, as they said, except the hair and nerve. So this is the OVA, infective stage, from the sheep, dogs, from the sheep, hydatid cyst in the liver, lung, and dogs, or in gut, ingested by human. And the commonest site to be affected in the human is the lung and liver. Pathogenesis, hydatid disease, echinococcus, hydatosis. The hydatid cysts are mainly located in the liver and lung. Rarely the cyst may be found in the brain, eye, kidney, muscle, and bone. The early stage of infection is generally asymptomatic. As the cyst enlarges, symptoms of space-occupying lesion is developed. Which means what? Which means headache, early morning vomiting, could be hypertension, and bradycardia. Clinical feature of Echinococcus granulosus infection remains silent for years before the enlarged cyst causes pressure symptom. Hepatic involvement can result in abdominal pain, mass, hepatic area, biliary obstruction, can be presented with obstructive jaundice. Pulmonary involvement can cause chest pain, cough, and even hemoptysis due to erosion of the lung parenchyma. Continuing clinical feature, rupture of the cyst is very serious complication. Can produce fever, urticaria, eosinophilia, and anaphylactic shock. Could be fatal disease, as well as cyst dissemination. At which time the cyst can be ruptured? Whenever you have trauma to the chest or to the liver. And the most important time for rupture cyst is during operation. In addition to liver and lungs, other organ, brain, bone, heart, can also be involved with resulting pressure symptom. This is a picture for intestinal hydatidosis. You notice a large number of hydatid cysts. So this is what we call malignant hydatid cysts. Difficult to be treated in this case, because if you remove all these cysts, the recurrence rate will be very high, and you can remove part of the stomach as part of treatment. Hydatid cyst in the liver. This patient had 3 cysts marked by arrow in the right. 3 cysts in the right. And this is hydatid cyst of the lung. Usually, as I said, they presented with a pressure symptom. This is single large cyst in the lung, and this cyst can cause hemoptysis and even can cause dysphagia and even dyspnea. Hydatid cyst in the brain or the skull, or this hydatid cyst of child. The rural at the top measure 15 centimeter long, and the child brain is below the hydatid cyst. The infection result in child death. This definitely cause increased intracranial pressure and even coning and brainstem affection and death. Two hydatid cysts in the brain of patient. The treatment mainly is surgical. Section of hydatid cyst. The cyst consists of thick outer layer, several thin layer, internal layer, and many protoscolices. And these are what we call hydatid sand or sands. Higher magnification of the protoscolices. This large picture for it. Protoscolics, not the hook, will form the hook associated with adult worm armed rostrum. So this is the head and this is the body, and protoscolices with double row hooklets. The eggs, which is diagnostic, which is infective stage. Eggs of Echinococcus granulosus. These eggs are virtually indistinguishable from eggs of tapeworm, such as Tine solia. Difficult to be distinguished. This is the Echinococcus granulosus in the small intestine of dog. These tapeworms are quite small, and single dog can be infected with many of them. Diagnosis microscopically. Aspiration from the hydatid cyst will show multiple protoscolices, size about 100 micrometer, each of which has typical hooklet. The protoscolices are normally invaginated and evaginated, and when they put on the normal saline. Diagnosis by serology, indirect hemagglutination test, indirect fluorescent test, and enzyme immune assay. Percutaneous aspiration or biopsy should be reserved for patient when other diagnoses are inconclusive because of potential for anaphylactic reaction. So whenever you have hydatid cyst in, let us say, in the liver, and you want to confirm the diagnosis, avoid aspiration because risk of rupture and anaphylactic shock. If aspiration is required, it should be performed under CT or ultrasound guided and should be done by expert surgeon or pathologist or radiologist. Complication can be minimized by concurrent administration of albendazole and praziquantel. So you can minimize the complication of rupture of hydatid cyst and then dissemination of the cyst or even anaphylactic shock by continuous administration of antihelminthic. Surgery is the most common form of treatment for Echinococcus granulosus. The drug of choice as medical treatment is still albendazole. Hydatid cyst should be excised whenever it is possible. About medical treatment albendazole 400 mg 12 hourly for 3 to 6 months, administered continuously without interruption. The drug is now often combined with percutaneous puncture aspiration injection of scolicidal agent and re-aspiration to result in good effect. What this means is in addition to medical treatment, we can aspirate the content of the cyst and at the same time inject scolicidal agent and re-aspirate. They use scolicidal agent, they use hypertonic saline or alcohol, ethanol. Cyst less than 5 cm may be treated with albendazole. This is guidelines for treatment of hydatid cyst. If it is more than 5 cm, should be treated with and adjuvant albendazole. Drug therapy for adjuvant treatment consists of 4 to 30 days preoperative and at least 4 weeks post-operative. So whenever you have a cyst and the size is more than 5, In addition to per aspiration and injection by scolecidal material, you should treat him with albendazole at least 1 month before the surgery and 1 month post the surgery. The approach to treatment for alveolar echinococcus consists of surgery. So lung hydatid cyst, the treatment mainly is surgery. Infected tissue should be removed as completely as possible, require complex excision of parasite tissue, and may also radical resection of the host tissue. So sometimes they need lobectomy whenever it is possible. In general, at least 2 years of adjuvant drug therapy is advisable in conjugation with at least 10 years of follow-up monitoring for recurrence. Some said it is not beneficial to give albendazole in lung hydatid cyst, but the guidelines said 2 years of injective drug therapy is advisable in conjugation with at least 10 years follow-up monitoring for recurrence of the hydatid cyst in the lung. Prevention, very easy. Avoidance of contact with dogs and other potential infected definitive hosts. Careful washing of the fresh product. Intermittent prophylactic treatment of Canidia with praziquantel, dogs and sheep, and also by effective vaccination of sheep has been useful for prevention of cystic echinococcus in some area. Thank you.